Italy continue to soar, but in hard-hit China, for now, the worst of it seems to be over. So what can health experts in the U.S. learn from these two nations as this nation gets more sick? James Longman files this report.
Tonight, 345 more people dead in Italy in the last 24 hours. The total now over 2,500. The health system buckling under the onslaught. Patients contained, although the virus is not. Families on lockdown. The dead are buried without them. Tonight, one glimmer of hope. Cases in Italy's original red zone down slightly. But back in America, concern over what's playing out in Italy. And they have more doctors and hospital beds per person than in the US. David, with America's top expert on infectious disease, Anthony Fauci.
Doctor, can you assure the American people that what they've witnessed in those images from Italy and from those hospitals won't happen here?
You know, David, I'm always trying to be as cold and honest. I don't want to scare anybody. There's no guarantee of anything.
That's why Fauci says Americans have to limit their exposure and public activities to slow down the virus so it doesn't hit with the same speed as Italy and so US hospitals can keep up with demand for emergency care. Dr. Fauci and other health experts are now studying the timing scene in Italy and in China to help forecast how long it could take hold in the US.
And James joins us now live in London with more. James, while Italy continues to struggle, China appears to be getting things under control. Why do experts think that that is?
Well, Lindsay, it's actually really interesting. If you look at when a country first reported its cases versus when it first did a lockdown, you start to see a pattern. We're far enough in now to this crisis to get a hold on how different countries have got to the outcomes they've got to. So if you look at China, for instance, its first reported case was on December 31st. Now, of course, China may have had cases before that, but that was when they first reported. And they first shut down Wuhan, that city in Hubei province where coronavirus originated, on January 23rd. And they've now started to see a slowdown. Compare that with Italy. They first reported a case, on January 31st, and they first did those lockdowns on February 21st. So a similar time period, except they only did a partial lockdown in the north of Italy. It was where I was for some time. We were back and forth to that part of northern Italy. They didn't shut down a wider area. That only came March 8th. There was a much larger lag, and that may be part of the reason why we're now seeing a much bigger issue in Italy than we have in China. Just to give you an idea, Italy now has reported to date 2,500 deaths versus China's 3,200 or so deaths. Now, obviously, Italy is a far, far smaller country than China, so its outcome is much, much worse. And we're now hearing, actually, if at this current rate of deaths in Italy, that Italy actually could surpass China in absolute fatalities. That is an extraordinary outcome. So there are a lot of lessons here to be learnt for the United States as it seeks to battle coronavirus. And a really important thing for America to understand is that Italy actually has more beds per capita than the United States. So it doesn't mean if you have a good healthcare system, you can ride this wave. There's a lot to worry about, I think, for the United States and the rest of Europe in battling coronavirus.
Right. A lot to learn, and fascinating to know that Italy has more beds per capita. James Longman, thank you so much for that report.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage,